From the research bench to the patient's bedside, this is Bench to Bedside with your host, Vice Chancellor and Director of the University of Kansas Cancer Center, Dr. Roy Jensen.
We've all experienced it. Maybe it was after a second cup of coffee, trying out a new vitamin supplement, or not drinking enough water during a busy day. I'm talking about a bitter taste in your mouth. An occasional bitter taste in your mouth is typically no cause for concern. However, a researcher at the University of Kansas Cancer Center has uncovered a fascinating connection between the bitter taste receptors on your tongue and colorectal cancer. Good morning. I'm Dr. Roy Jensen, Vice Chancellor and Director of the University of Kansas Cancer Center. And joining me this morning to explain the bitter taste colorectal cancer connection is researcher Dr. Prasad Dandawante.
Hello.
Also joining us is Kathy Benich, a colorectal cancer co-survivor. We call her a co-survivor because her husband developed and eventually passed away from colorectal cancer. Kathy is also a member of our patient research advocacy organization, which is called Pivot. Pivot members, like Kathy, give our researchers the lived cancer experience, and we rely on them to help guide our research. Welcome, Kathy. Thank you for joining us today. Can you share with us how and why you got involved with Pivot?
Sure. Thank you. I'm happy to be here. In terms of Pivot, my husband John's 2-year colon cancer journey, throughout that journey, I did learn a lot. And I also have a background in process improvement. So I wanted to find a way to be able to give back some of the knowledge that I had. And I felt that we can and should do better. So I noticed an ad on Facebook for Pivot, and it sounded interesting. I went to their introductory meeting, and it was just a perfect fit for the way I wanted to give back. So I've been a happy member of Pivot ever since.
Well, very good. Well, thank you so much for sharing that story, Kathy. As I'm sure you're well aware, March is National Colorectal Cancer Awareness Month. And it's a time we encourage survivors and co-survivors to share their stories. This helps doctors and researchers continue their groundbreaking advances to save lives. Dr. Dandawante, a fascinating discovery that was made in your lab has to do with the bitter taste in your mouth that can be a symptom, amazingly enough, of colon cancer. Can you explain how you came to make this discovery?
Thank you so much for invitation. And so it was an interesting story. So when I was growing up and doing my grad school, my dad and mom always tell me I'm having headache, I'm having back pain. And I keep thinking, like, what should I do? I was doing some research, following the signaling pathways and everything, and I never thought. But what I realized there is that it's very important to see what patients are thinking and what are their problems, and then formulate your research accordingly. So when I joined University of Kansas Cancer Center in 2015, I was working in Sri Anand's lab, and one of the lab meeting, few cancer patients came to see our research, what we are doing, and during talking to them, they mentioned having this bitter taste in their mouth. And I was like, why there is bitter taste in the mouth? And there were 2 patients, and both of them said the same thing they discovered. Then one of the colleague, he also mentioned during the same time that one of his family member who passed away because of the cancer, he also complaining about the bitter taste in his mouth even before his cancer was detected. So I thought this is exciting. Why everybody is having a bitter taste in the mouth? Because cancer is growing in colon, and why we are feeling taste in our mouth, which is bitter. So I thought this is exciting to know, and I really went and looked into some databases where we can see what type of receptors are those. And so bitter taste are usually recognized by these receptors, which are present on our tongue. And a lot of studies has been done how to treat them, because if you have a bitter taste in your mouth, you don't want to eat, right? It's like it is affecting your food intake. So overall, your nutrition is reduced, and then your quality of life is slowly reducing. So I thought this is important, and if cancer patients are facing this, this might be something else we should also look at, which has not been done before. So I went and looked into different databases, and I also found not just tongue is getting affected, but these bitter receptors are also present on colon, and they are highly expressed. That means their number of receptors are going up or increased in colon cancer as well, while in normal colon there are very few beta taste receptors are present. So with that, and then I interacted with the pivot, and I talked about it, and I got very good feedback about how cancer patients are having bitter taste, especially colon cancer, and that's how I started working on this.
So do we know yet why this phenomenon of bitter taste seems to be happening with colon cancer patients and say not leukemia patients? Or
so this is very exciting. So during my search or initial preliminary data, what I saw was mainly these receptors are expressed on gastrointestinal tract, especially on colon cancer. And now we know colon cancer is the majority of the all GI tract cancers, and it is the third leading cause of cancer death in the United States. So I thought it is interesting, and only why some set of the group colon cancer are having this bitter taste in the mouth is a problem. So we really don't have a concrete data to prove that why it is only happening, but we have an interesting, we're formulating an interesting clinical trial. We're planning it, where what we'll do is we'll get colon cancer patients, we'll enroll them in a trial, and we'll take a swab from the mouth, and then when ultimately we take biopsies, we'll take those tissues, and then we'll look at this taste receptor expression in both of those, and then see if there is some correlation. And more interesting will be whether they're talking to each other. Like why a tumor growing in the colon cancer making taste bitter in the mouth. Mm-hmm. So is there any correlation? Is there any crosstalk between these two? That's what I think will be the right thing to do and find out in the future.
All right. So what about, is there a difference between the taste that we perceive, say, when we bite into a lemon or something like that, versus the taste that patients with colon cancer have?
Very interesting question and very fascinating. I think that's the first question I also thought. So when you eat anything bitter, you eat it, your taste receptors recognize your bitter, you have bitter food in your mouth, then you swallow it. And you know what happens? If you drink water, bitter taste is gone. Now you don't feel anything bitter in the mouth. So with this colon cancer patients, this is like you're waking up in the middle of the night, and suddenly you're having this bitter taste in your mouth while you're not eating anything, right? Or if you're eating something which you're very familiarized with the taste, but when you eat that, you suddenly started feeling it bitter, and you're like, this is not bitter. So I think there is a matter of consistency, like where you eat the food, it's temporary, you feel the taste, and then taste disappears. But if you have a colon cancer, then you're eating something and you have this bitter taste for consistent long time, even when you're not eating. You have this feeling in your mouth that everything is bitter. Mm-hmm.
So, Kathy, did your husband experience this bitter taste phenomenon, and how was he diagnosed with colorectal cancer?
Well, he never mentioned a bitter taste, but the way he was diagnosed, not every symptom presents itself in every patient. And so for my husband, it was primarily fatigue. That's what we noticed. He had very extreme fatigue. In fact, the way we found out, we were in Paris. I was running a half marathon there, and he normally goes and sends me off at the beginning of the run, and we stroll. He didn't really feel up to doing any of the things that he normally enjoyed. He was very fatigued, and we started talking about it, and he had some blood in his stool, but it was very small amounts, and he kind of wrote it off thinking it might be a hemorrhoid. But as we talked about it, we thought we need to get in and see his physician right away. So we made an appointment with his primary care physician and saw her the day after we got back to Kansas City. And he was taking a baby aspirin at the time, and you can't have a colonoscopy after you've taken something that could thin your blood. So we had to wait 1 week before he could get a colonoscopy. And so he was scheduled for a colonoscopy and an endoscopy. And then she sent him for a CT scan, thinking that might at least give us some insight. And I remember on Friday, late Friday afternoon, she called us and she said, I wanted to let you know that at least it's not cancer. We've gotten the results of the CT scan and it's not cancer. So next week with the colonoscopy, we'll figure out what it is. Well, obviously next week we found out that that was incorrect. The CT scan did not reveal the colon cancer that was seen very clearly in the colonoscopy. So after that, we just started a whirlwind of going forward with treatment and testing and all of that to move forward.
Okay. So Dr. Dandawande, an alarming fact that's come to light in the last few years is, colorectal cancer seems to be becoming more prevalent in young adults. Is there a reason for that, you think? And is it because we have better detection methods or lifestyles are different or something else?
So you are extremely right. It's in recent years, the statistics shows that colorectal cancer incidence is going up and up in a younger population, and which is really a matter of worry because right now the standard is 50 years and more than you get colonoscopy as the prevention. As we all know that early detection is very important in colon cancer, and as we started seeing these trends in younger population, it's important to get screened early. Now it might be a combination of multiple reasons. Definitely we have better methods now to detect colon cancer. We have hectic lifestyle. We have less sleep. We have sedentary life because we try to do less exercise. We're not because of the stressful and long work, maybe working a little bit hard, or there might be a number of factors that won't let you go to the gym to do exercise or do the exercise on where. Then diet. Our diet habits are changed. High carbohydrate diet or high meat. There are also probable reasons for colon cancer. And I think it's not just one factor, but it's a combination of all which are coming together, and that's why younger population is also getting colon cancer now.
So you touched on the age at which screening is recommended, and I know up till pretty recently it was 50 years of age, but now the U.S. Preventive Task Force has actually moved that down to 45 as a result of the this phenomena that we're seeing of younger people getting colon cancer. So let's talk about early detection a little bit more. Mm-hmm. If we find a cancer early when it's small and hasn't spread, that often allows us for quite a few more treatment options. And I think we've all seen commercials for tests that are used to screen for colorectal cancer, and colonoscopies, but also a number of other laboratory-based tests. And that recommended age, as I said, used to be 50 and now it's 45. So Kathy, how old when you first got your first colonoscopy?
Well, I turned 50 before they changed the guidance to be age 45. So my first colonoscopy was at age 50. Since then, I've had a second colonoscopy. And I can say that between the two, things are easier now. The colonoscopies not only help you detect cancer, but they also help look for polyps that could be precancerous. So those can be removed in time before they become cancerous. But between the two colonoscopies, I know a lot of people worry about PrEP and drinking a lot of fluids and things like that. It has gotten better because my very first one, I was up all night long, rushing to the bathroom because of the PrEP. The second one, just 5 years later, was much better. I was able to sleep a full night, and then all of the PrEP was pretty much in the morning before I went to the doctor's office. It was a much narrower time frame, which meant I wasn't exhausted. In fact, after my last colonoscopy, I went out to dinner with my niece and nephews right afterwards. And so it is better, and it is the gold standard. As I mentioned before, it's where you can find out for sure, whereas a CT might not be accurate for this.
So that sounds like a pretty good message for people that may be contemplating getting that first colonoscopy. It's not as bad as what you might think there. So if you're just joining us, we're here with Dr. Prasad Dandawante and cancer co-survivor Kathy Benich discussing advances in colorectal cancer. And remember to share this link with people you think might benefit from our discussion using the hashtag #BenchToBedside. Alexis Del Cid is also here to take your questions. Hi, Alexis.
Hello. We have so many great questions. This topic is fascinating. Elena Owens has a question. She would like to know, Dr. Dandawante, would the bitter taste happen before you see blood in your stool or other symptoms? Would it happen simultaneously? Or can a bitter taste simply be your only symptom of colon cancer?
So there are multiple symptoms and not really one symptom that can detect colon cancer. What is hope with my research is, so you are having bitter taste in mouth, which is making you feel uneasy. It can be an indication of something going on wrong with you. And with my studies, if I could able to establish that this bitter taste receptor has associated with particular type of colon cancer in early, what we can do is we can go talk to the doctors, your physicians, and tell them that this is what I'm feeling, and then they can direct you to the colonoscopy. So really, we don't know right now whether you see the stools, blood in the stools before you feel the bitter taste or not, but we are working on it, and I think we'll have the answers soon about these questions.
Amy Capsalis has a follow-up question. Mm-hmm. She wants to know, why do you think this is happening? Did you simply have it happen to enough people who said, I have a bitter taste in my mouth, where you were able to make the connection? I mean, how did you even think to study this and make the connection?
So it's as I mentioned before, it started with experience of the patients because they talked about it, and that's why I started looking. And as Kathy also mentioned that not every patient is going to have same symptoms, but when I talk to the patients, we have a lot of patients complain about bitter taste in their mouth who have colon cancer, and some of them actually said that we have it even before we got detected with colon cancer. So we thought this is interesting to study. And that's why we are actually planning or trying to formulate a trial where we can actually study this, where we can interview these colon cancer patients and really get the data with significant number of patients, where we then we can conclude this with the statistics, where we can say whether it's what percent of patients are having this symptom.
One more question from Jane.
Mm-hmm.
Jane would like to know if you think that the bitter taste could also be related to acid reflux, and if acid reflux would be a possible symptom of colon cancer.
So, it's a very interesting question. So acid reflux have connection with bitter taste because you get acid put in your mouth and acid is bitter, that's why you feel it. But if you really think, when you don't have acid reflux or you pass that phase where there is no reflux anymore, you don't have taste in your mouth anymore, right? It's temporary phenomenon again. So I think not acid reflux just cannot be one indicator of colon cancer, like bitter taste, and it is in relation to colon cancer. If you have a persistent taste of bitterness in your mouth, I think that's the key for indication that it might be colon cancer.
It's fascinating.
So, Dr. Dandawante, colorectal cancer is now the third leading cause of cancer death in young adults, which I think most people find quite surprising. Do you think the discovery of the connection between bitter taste in the mouth and cancer may prompt more people to get screened and diagnosed earlier?
Yeah, I think that's my whole hope, that if I establish this connection in significant number of patients, and then you imagine you need to wait till age 45 to really go and get colonoscopy, or 50. Now it's 45, so you can get screened at 45, and if you have polyps or any indication of cancer, you can treat early. But imagine if you are like 35 years old and you're having this continuous bitterness in your mouth or unease, but you really don't know what to do or where to go. For those patients, it will be exciting really to go talk to the people, and if they are having cancer and we could able to do it, then they can go for colonoscopy. So physicians will recommend them for colonoscopy. I think this will help lot people to get it detected early if they are having this symptom. And I think that's my hope, that if I could able to establish this bitter taste, and then you go to the doctor and then they recommend you colonoscopy, and then you can detect it earlier than 45 as well.
So Kathy, I want to turn back to you. You have been a part of the team that is researching this phenomena in Dr. Dandawante's lab. Could you tell us a little bit about your role and kind of illustrate how this PIVOT program works?
Sure. The way PIVOT works is we bring a lived cancer experience. So we know certain things might impact a patient's life. And for example, if maybe an intervention is being recommended, we may talk about other things that should be looked at. You mentioned nutrition. So we may want a nutritionist to speak with the patient to make sure that during this particular treatment that they're keeping their nutrients up and keeping a good, healthy lifestyle. We may also listen to what the intervention is or the study and suggest, because we've seen some of these side effects, we may suggest that those side effects be emphasized more so that the patient understands the risk, understands exactly what the side effects entail so that they can make an informed decision. So we basically just use our knowledge of having been either a caregiver or a patient, co-survivor or patient, and bring that out so that we can make the patient experience better in the end.
Okay, so Dr. Dandawante, could you tell us a little bit about how you utilized Kathy and the other patients' input in directing and moving this project forward?
Yeah, so PIVOT has really played an important role, because when I actually started doing this research and I was working on my grants, I actually got involved with PIVOT and I met a lot of patients. I talked about this, and a lot of cancer survivors and other advocates helped me and motivated me, like, yes, we had this. A lot of other people they know also had this. So because I mentioned earlier there are receptors on the tongue as well as the colon cancer, as a basic scientist I was more focused on finding their role in colon cancer growth. But when I got involved with the PIVOT and Kathy actually made me realize that this is a key for early detection and it will be more important. And I focused my research also on the early detection because of it, and establishing bitter taste as a method or as an indication for detection of colon cancer.
Uh-huh. So Kathy, I'm curious, how did you find the world of biomedical research and your ability through PIVOT to get a peek into how all of this works, and what did that really mean to you?
Well, like Prasad said, definitely the early detection, but it's rewarding to actually see how some of the advice you're giving is going forward. I found it all fascinating. I don't have a medical background, but I have this experience where I did learn a great deal, and I have the want and desire to help the patients. So it's been fascinating, and throughout the process, PIVOT also does training to help us understand certain things to look for, certain things to, like for example, we want to make sure that the materials that are going out are very easy to understand, clear, when you hear the word patient or cancer, you very quickly stop listening because you're fearful. So we want things to be as easy for the patient as possible. And we share ideas and then work with the investigators and scientists to help make sure that their idea, their scientific idea and medical idea works well with a patient's lifestyle and quality of life.
So, it's obvious that your husband's cancer experience really led to a whole number of different changes in your life. And not only did it prompt you to join Pivot, but my understanding is that it also changed your career path. So tell us a little bit about that.
It did. It actually changed. I think of it as like the 3 table legs or something, because I have my volunteer job with Pivot, which is very rewarding. I also, I have an MBA and have always worked in business. And I went back to school. So I'm working on a master's in public health so that I'm learning more about that. And then I changed jobs as well. I had a job where I focused on the employee experience and in terms of human resources systems, making sure that all of those systems were supportive of an employee. And I did that primarily with healthcare. So I changed companies. I'm now with a smaller targeted firm, the Chartis Group, and we work only with healthcare. No other types of clients. They're all healthcare clients. And so what we do is not only systems, which I'm still working with the employee experience, but there's also a strategy group and an oncology division. And so my goal is, as I learn and grow, to move more into the healthcare strategy and oncology strategy, and trying to do the best I can from that angle, from the business angle, to also enhance the patient experience. So yeah, I've changed everything.
So now that you're in the healthcare workforce, how would you say that that's influenced your experience as a patient research advocate? And do you think that do advocates need those types of backgrounds to participate in Pivot?
Well, no, we don't. And you in listening to Prasad, you notice he knows the science, he knows the medicine. He doesn't need help with that. What we need to do is bring that patient experience, being able to look through the interventions, the science, even the consent forms, to make sure that they're very easy to understand, very clear, bring out all of the side effects that might happen in an intervention or a study. So you definitely don't need to have a medical background, but you need that lived cancer experience, because we all know what it's like. Unfortunately, we've been through that, and we all have a desire to improve that patient experience.
So I know that some of you that are listening this morning may be wondering, how do I get involved in Pivot? And the answer is you can either visit kucancercenter.org/pivot or email pivot@kumc.edu. Now I want to turn back to Alexis. Do we have any additional viewer questions?
We have many questions. Again, this topic is so interesting and something that a lot of people never thought about, having a bitter taste in your mouth indicate colon cancer. Jenny Hepner wants to know if you think insurance would cover a colonoscopy if you're under the recommended age, but the bitter taste is your only symptom. I know we're getting into insurance coverage, but that's a question a lot of people sitting at home are going to have.
Yeah, I'll probably take that question.
Okay.
I suspect at this point there's not enough scientific evidence to have that as a covered benefit. But hopefully, if the research proceeds well, that maybe that one day that will be an indication for a colonoscopy.
Could reach a lot more people if that was
Yeah.
the case, so they wouldn't have to wait until they have those physical symptoms. Troy wants to know, has a question for Kathy. Kathy, did colon cancer run in your husband's family?
No, it didn't. In fact, both of his parents had no history of cancer and lived till 97 and 98.
Wow.
So, yeah. And also I want to mention that he was an active person. He rode his bike, he hiked. We were pretty much pescatarian. He didn't eat a lot of red meat. He doesn't fit what you think of the colon cancer patient. And we're seeing that more now. The younger folks, they may be physically fit. So something is happening, but it's not the traditional what you think of.
Right. I mean, you just said you were about to run a marathon or a half marathon in Paris with your husband when he was feeling so rotten. Mary has a question. I think any doctor would love to weigh in on this. And Kathy, you might want to weigh in on this. Mary writes, how do I convince my sister she needs to get a colonoscopy? She's 50. She doesn't think she needs one because colon cancer doesn't run in our family. I mean, you just made a case for it talking about your husband.
Well, and actually, I believe it's 10 to 15% of cancer is hereditary. The rest is due to, we don't know what. Lots of indicators, but we don't know what causes colon cancer. And I empathize with her because I am still trying to get my sister to get her colonoscopy as well.
So even seeing what happened in your family, you have family members that are reluctant.
So one thing
Yeah.
I might add to that is
Yeah.
colonoscopy remains the absolute gold standard for detection. Although I'm sure everyone has seen the advertisements for the getting the kit in the mail and then sending back a stool sample to detect colon cancer for normal risk patients.
Mm-hmm.
And the efficacy of that test, I think, is quite good. It's not as good as colonoscopy, but perhaps that could be a way to at least cover that gap for patients that are not quite ready to make the leap to colonoscopy.
You just answered Angela's question. She's one of our Facebook viewers, writes in, are the at-home tests accurate? So they are accurate, but not the gold standard that is a colonoscopy.
They really can't be as good because obviously it's a direct visualization of
Right.
the colon. So
Marites has a question. Do we have time for more questions?
sure.
She would like to know, how do you know if you have, and this is a question you touched on, how do you know if you have just a regular bitter taste from your morning coffee or if it's cancer? Is it the strength of the bitter taste? Is it how long the bitter taste sticks around?
Yeah, so I think it has to do with persistence. If your bitter state stays in your mouth for a longer time, even after you stop eating the food, right now you have no food in your mouth, you're not drinking anything, or you're just sleeping, getting up in the middle of the night, and suddenly start feeling bitter taste. That might be an indication, not when you're having coffee, because coffee has a bitter taste. So you can drink coffee, have this bitter taste in mouth for some time, and then when you drink water or after an hour, you're not going to feel that bitter taste anymore. But if you're still feeling it for longer times, not just with coffee, with anything, and like I said, you get up in the middle of the night and you're still having this taste, then it's a problem. Then this is something which can indicate that you have unease or maybe colon cancer. You should get screened.
To piggyback on that question, Jim wants to know if the bitter taste goes away once the cancer is gone.
Very exciting and interesting questions. I really don't have any data to tell that, but I think it is expected that when you not have a disease, it should go away because it is caused because of the cancer. I hope that, but I really don't have any data to tell that with confidence. Yeah.
Wow.
All right. So I want to ask one last question of both of you, and I'll start with Dr. Dandawante. What are you most excited about when it comes to the research projects that are going on in your laboratory right now?
So, colon cancer, or like foreign say cancer, is a major reason for a lot of people, a lot of cancer death in United States. And I think what I'm more excited about working here at, like, you get to meet patients, you get to know their experience. Like Pivot is helping us also to get that. Based on their experience or their symptoms, we can actually formulate our hypothesis and do work which is directly applicable to patients, and it will make their life easier or have better quality of the life because of the inventions and discoveries which we are doing at Cancer Center.
Mm-hmm. So, Kathy, you were a caregiver for your husband, and that can be a really tough role, obviously. What advice do you have for those of us that are trying to take care of a loved one with cancer?
Well, first, accept help. People want to help, they don't know how to help. And so if they ask, say yes, accept that help. Some of John's friends were looking for ways to help, and it turned out that some of my regular medical appointments were coming up. And so they hung with John, had lunch with him or something like that while I went to my medical appointments. Also taking time to rest and recharge, because that's really important. Like they say in the airplanes, put your own mask on first, because if you're out of breath and can't breathe, you're not going to be able to help someone else. And also eat right and get enough rest, because that is so important for everybody. And I know that during when John was having his treatment, and sometimes he'd get up during the night, I think I slept a lot lighter than I used to, or than I had before. And I think that's natural, but make sure you are getting the rest that you need, so that you can be there the way you want to be there for the person you're caring for. And then for everyone, make sure that you talk about your wishes before anyone's sick. John and I talked about what our wishes were, our final wishes. I knew he wanted to be cremated. We talked about that well before he was sick. Once somebody's sick, it's a scary conversation, but if you talk about it early on when nobody's sick, then it's not so scary, and it just seems far away. It's just easier. So that's my advice.
Good advice, Kathy. Any final questions, Alexis?
Not so much questions, but a lot of people are saying thank you for this episode, and thank you for the PSA. Angie wrote, PSA, get your colonoscopy. Sarah writes, it's strange and scary and surprising. And Mandy wrote in that this is a fascinating topic. Really an interesting discussion.
All right.
Yeah.
Well, thanks, Kathy, especially to you for being part of this week's episode of Bench to Bedside, and Dr. Don Duante. To learn more about Dr. Don Duante's work studying the connection between taste bud receptors and colon cancer, visit kucancercenter.org/tastebuds. That's it for today. Join us next week at 10 a.m. for Bench to Bedside. Thanks for watching. Subscribe to our Bench to Bedside podcast, now everywhere podcasts are available.